Hello, everybody. Thank you so much for being here with me today. My name is Astrid Ortiz. I'm currently a graduate student in the Communication Sciences and Disorders program at the University of Texas, Rio Grande Valley. And today I'm going to be discussing some information about my thesis titled Acoustic and Perceptual Effects of Voice in Mask-Wearing Healthcare Practitioners Pre- and Post-Work Week. So what does this study kind of attempt to do? This study is trying to address the vocal and communicative impacts of prolonged mask use by in healthcare practitioners during the COVID-19 pandemic. On top of that, I really wanted to understand the relationship between perceptual information that was being shared by these subjects and the acoustic data that was also shared by these subjects. And on top of that, I also wanted to understand the relationship of hydration and just vocal quality, vocal well-being, and vocal treatment. And so I did establish a control and experimental group in the study in order to assess that part of the research. So today I'm going to mostly be talking about one aspect of my thesis, and that is the survey. So I'm going to go over the methodology a little bit. So this study was approved by the IRB on November 17th, 2021, and was mostly, recruitment mostly was done via word of mouth and the use of a flyer that was approved by the IRB. Participants in this study were asked to complete 2 tasks, one of them being for them to complete the survey, which I'm going to be talking about, and then completing some voice recordings pre and post work week of sustained vowels, and then the rainbow passage, which was outlined in an instructional PDF that was shared with all participants, outlining sort of tasks that they needed to do, some instructions, and to sort of let them know based on whether they were experimental or controlled, what it is that they were expected to do. So in total, there's about 19 participants who had voice recordings submitted, and of these, about 14 to 17 of them participated in the survey that I'm going to be discussing in via Qualtrics. The reason I say 14 to 17, excuse me, is because some of these questions were not answered by all participants, and then some of them did allow for multiple answers to be selected. And so that number kind of shifted when you look at the actual data that you got from that. So I'm going to briefly go over some of the literature concepts that kind of influenced my research. So because we're talking about COVID-19, we know that this was a very novel situation. It was very different, and it was something that, for the most part, although it obviously affected the general population, we saw, a lot of changes that occurred. Healthcare practitioners and just the healthcare field is definitely an area that was impacted. Healthcare practitioners were being asked to, increase PPE, reduce transmission, use masks, all the while just being asked to continue providing quality care, being able to communicate effectively, being able to talk to patients, talk to their family members, and just keep on being amazing at what they do during a very, very difficult time. So that's definitely something that we need to consider. Because they had increased, PPE that they needed to use, masks were one of them. And so one area that I really wanted to look at was history of masks. What's the difference between now and before? Perceptions of mask use. On top of that, I wanted to look at differences of mask types. What types of masks were participants using? Were they double masking? Were they masking only one? Were they using surgical respirators? Were they using all sorts of different things? And one of the reasons I wanted to look at that was because, according to some research by Yao, Rodnovich, and Ribeiro, the type of masks could have an impact on voice and communication, especially depending on, the thickness of the mask. Another thing is I wanted to look at frequency and duration of mask use. So how often were participants using them based on research? Working groups were stated to have experienced higher instances of vocal fatigue, pneumophonoarticulatory incoordination, vocal tract discomfort, and so on and so forth. And on top of that, I wanted to look at communication effectiveness in workplace settings. It's really interesting. Hyder reported that the setting in which we are in, we have to speak about 10 to 15 decibels above the environment that we are in order for our message to be about 90% accurate. And we also need to consider, at least in this particular situation where masks are being used, that when we have something covering our mouth, that can actually decrease the intensity of our voices by around something like 20 decibels. And so when we kind of take that into consideration, we really think about how, we're having to speak already, without a mask, you have to talk above a noise level, but now you have to talk about above that noise level. And then you're also having to consider that disparity of your mask decreasing how loud you are. So that really goes to show that this is definitely something that could affect how much effort you're putting into your vocalization, which is my next point. How much effort were individuals experiencing in terms of like vocalizing and breathing. On top of that, I wanted to look at hydration, and I wanted to look at any pre-existing conditions, things like asthma or gastrointestinal reflux or sinus infections, which of course could affect, your vocal symptoms and just any type of discomfort that you're feeling. So research question 1 is basically going over, does the use of masks result in high reports of impacted communication in healthcare practitioners? And overall, we definitely see that in all of the statements, everyone at least reported a minimum rating of 1. So this is using a Likert scale from 0, which is representing something never occurring or the statement just not applying, to 5, which is a statement applying or a behavior constantly happening. So in all statements that are basically going over effortfulness, having to repeat yourself, having to use alternative means of communication to effectively communicate with, coworkers or individuals you're treating. If you feel like your vocal health has been impacted, if you feel like you're having trouble understanding other individuals who are wearing a mask, if you feel like you're having trouble breathing, we see that all of them, for the most part, have given at least a minimum score of 1 and a maximum score of 5, which is max impact or max presence of this being applicable to that individual. And so on top of that, we also see that the means show us that a lot of these individuals are also indicating scores of like 3.93, 4.06, 3.63, 2.71, 2.93. And all of these, of course, fall in the middle. So that tells us that there's definitely a presence of communication being impacted when you're having, masks or you're using a mask for a long time. So that definitely tells us that there is something to wearing a mask and that it could be affecting communication, definitely, as per these participants' perceptions and their reports. So the next research question is, how often are healthcare workers using face masks during working hours? And does prolonged use of masks result in high reports of vocal sensation and effort in healthcare practitioners? So based on my survey, a lot of participants indicated about 62.50% of them were working an 8+ hour shift a day. So they're working an average shift, and 80 of them did state that they were working at least 6 hours a day. So they're using their mask for a significant amount of time. And they indicated that in terms of vocal effort and breathing, if they had to indicate effortfulness on a scale of 6, which is easy or no effort required, to a score of 20, which is maximal effort, they are reporting effortfulness in terms of vocal effort. The mean of 16 responses was 13.69, with a minimum score of 9 and a maximum score of 20. And breathing had with overall responses being 16, it had a minimum score of 8 and a max score of 20. So we're definitely seeing that there are reports of effort in there in regard to vocalization and respiration. And of course, the means also show us that they're kind of falling in this middle line of this scale. On top of that, we are seeing reports of vocal symptoms. We're seeing high reports of dryness with a 22.58%, We got fatigue and weakness with 19.35, loss of voice, decreased volume, and increased throat clearing with 12.90. You've got hoarseness at 6.45, strain and tightness at 9.68. You've got, breaks, or you feel like your voice is kind of coming in and out at 3.23, and pitch changes at 2.23. 3.23, I'm sorry. So you're definitely seeing these sensations that are being reported by these individuals during, prolonged use of masks. So some additional areas that I kind of wanted to touch on was hydration, pre-existing conditions, and settings. So most of the individuals in this particular study were working in a rehabilitation. 58.82% of them indicated as such. And the next one was hospital, with 29.41% of them indicated that they were working in a hospital. The other two individuals were working private practice and school, with a percent of 5.88. And of course, these individuals also reported pre-existing conditions. 50% of them actually reported allergies, which is of course very common, but it does let us know that these individuals are experiencing these conditions on top of, all these other things. So allergies at 50%, other conditions that were not specified at 22.73, and acid reflux and sinus infections at 13.64. So those are pretty big numbers. A lot of them are reporting feeling these or experiencing these conditions, I'm sorry. And on top of that, another area was hydration. So how hydrated did these individuals think that they were? And most of them did report that they were hydrating adequately during their work week, with 57.14 of them saying that they were hydrating during working hours. And so that's overall just kind of a peek into the survey aspect of this study. Thank you so much for, sticking around and listening to my presentation. I really, really appreciate it.